as we both work together to, really bring this win home for Black moms in the workplace, and also to reflect on what worked, what strategies worked, and what ways we can continue this fight for equity for Black mothers. And I will just say that this webinar is going to be recorded, so we will share the recording afterwards in the following days. And there is also a Q&A function. So if you have any questions for Stephanie or I, you can put them in the Q&A and we'll have some time later today to address them. But first, just want to introduce myself. I'm Cameron Dawson. I'm a senior staff attorney here at A Better Balance, and I work primarily in our Southern office in Nashville, Tennessee, working on advancing legislation and supporting moms and caregivers in the workplace as they navigate their rights and maintain their health. And so today I am joined by Stephanie, and she is going to share how do we address, social determinants of Black maternal health in the workplace, and why it's so important to really highlight these policies on a systemic level, because we can't look forward to the future without addressing our history, but we also want to carve out time to share some of those celebrations and wins and reflect on that, and the joy of really highlighting worker stories and experiences. So Stephanie, I'm going to turn it over to you.
Thanks, Cameron. I will share my screen. So hi, everyone. My name is Stephanie Aristide, and I am Black Mamas Matter Alliance Policy and Advocacy Associate. Just a little bit about myself. I have my master's degree in public health with a concentration in maternal and child health. So I'm still relatively new in this space, but I have some work experience with health, Department of State Health Services. I've worked on obstetric care for women with opioid use disorder, and I've continued gathering evidence and data to assess health disparities and community needs for breastfeeding, safe sleep, and obesity. And so my main focus here at BMMA is to track our state policies within the state of Georgia and other southeastern states. I also engage with our key stakeholders and build out some of our advocacy initiatives. So with that being said, we have a really great presentation for you all today on best practices and policy recommendations to address pregnancy workplace accommodations and ways to advance Black maternal health. I want to thank Cameron, and I want to thank A Better Balance for bringing us all together. And I'm so inspired by their continued dedication to advocacy and justice for pregnant workers. So for this webinar, I will provide an overview of BMMA, the work that we conduct within our 4 key pillars, which is policy, research, care, and culture shift, the journey and innovation of our comprehensive issue-based policy agenda, and then an overview of policy recommendations that we have for pregnancy accommodations and how to utilize the policy agenda with advocacy strategies. Just to share, we want to note that all content included in or made available in this presentation is the sole and exclusive property of BMMA and its partners, and we're protected by the United States and the international copyright laws. So any usage of any of our content must be explicitly approved by BMMA in writing and properly attributed to BMMA and appropriate parties in all instances. So for this webinar, we have no conflict of interest to declare. So I'll go ahead and provide an overview again of BMMA and the Black maternal health right and justice movement. Just to give us some background, so the Black Mamas Matter Alliance is a national network of Black women-led and Black-led organizations and multidisciplinary professionals whose work is deeply rooted in reproductive justice, birth justice, and the human rights framework. This is in order to ensure that all Black mamas have the rights, respect, and resources to thrive before, during, and after pregnancy. So our alliance includes a diverse range of professionals from midwives and doulas to OBGYNs to nurses, lawyers, academics, and public health researchers. We operate at the national state. We operate at the national, state, and local levels and collaborate to advance policy, promote holistic maternity care, cultivate research, and uplift culture to advance Black maternal health. So BMMA honors the work and historical contribution of Black women's leadership within their communities and values the need to amplify this work on a national scale. So for this reason, BMMA doesn't have any chapters. So at BMMA, our work falls into four main bucket areas. We approach our work through the goals of working to change policy, and we do that by utilizing the human rights framework to address health inequities and improve Black maternal health outcomes. We work on cultivating research that leverages community knowledge and Black feminist scholarships to advance care by promoting holistic, respectful, and comprehensive maternal and reproductive health approaches to Black mamas care. And lastly, we work to shift culture by dismantling negative narratives on Black motherhood and amplifying the voices and experiences of Black mamas. So as efforts to address maternal health inequities in the US, we must be more intentional about centering the innovation of Black-led maternal equity initiatives across the country and globally that are making a difference. And so throughout this presentation, you'll hear me use the phrase Black mamas. So we use Black mamas to include a range of folks from women to birthing people all across the African diaspora, to those who care for and mother our families and our communities, whether they have given birth or not. So we want to make sure that we say that we stand in solidarity with all Black mamas in every shape and form. So I'll go into a little bit of our work and some of the impact that we've made at BMMA. As mentioned, BMMA uses the birth and reproductive justice framework to advance a human rights-based approach to respectful birth care grounded in the scholarship of Black feminist and womanist perspectives. The following theoretical frameworks developed and utilized by Black women scholars, practitioners, and advocates help to frame and guide BMMA's work, most especially in research and policy and maternal and reproductive health care. So these frameworks also inform the work of the Alliance, incorporate activist perspectives, recognize Black women as experts that produce knowledge and information that will institute changes in their lives and in their communities. So for that, we recognize that Black mamas' human rights to health and safety, as well as their rights to have children, not have children, parent their children in safe and sustainable communities, and maintain personal bodily autonomy. So by centering Black women's leadership and creating opportunities to showcase their ingenuity, BMMA is able to contribute towards gender equity, utilizing principles rooted in Black feminist and womanist organizing. So we use it as a strategy to combat inequities and systemic oppression that drives maternal mortality and morbidity. So a little bit about the programs that we have at BMMA. So BMMA has multiple programmatic efforts. That includes our Black Maternal Health Week. Black Maternal Health Week was founded by BMMA, and it's celebrated every year in April as a national initiative from April 11th through the 17th. It's also during National Minority Health Month. So Black Maternal Health Week is a week of awareness, activism, and community service to amplify the voices of Black mamas and to center the values and traditions of the reproductive and birth justice movement. So more specifically, Black Maternal Health Week is to deepen the national conversation about Black maternal health in the US, amplify community-driven policy, research, and care solutions, and centers the voices of Black mamas, women, families, and stakeholders. It provides a national platform for Black-led entities and efforts on maternal health, birth, and reproductive justice. And lastly, it enhances community organizing around Black maternal health. A little bit of the impact that we've made for Black Maternal Health Week. On April 13th, 2021, the White House officially recognized Black Maternal Health Week, and then later marked December 21st as Maternal Health Day of Action for the first time ever. So from 2020 to 2022, there were also more than 170 events hosted during Black Maternal Health Week all across the US, and it's by BMMA partners and collaborators. Black Maternal Health Week continues to build awareness, not in the United States, but also in several countries across the continents of Africa, Asia, and Europe. So also founded and led by BMMA, in 2018, we had our Black Maternal Health Conference and Training Institute. That was the premier assembly in the US for Black women, clinicians, professionals, advocates, and other stakeholders, all working to improve maternal health using the birth justice, reproductive justice, and human rights framework. So in 2018, we hosted the conference for the first time ever in Atlanta, Georgia, with over 400 in-person attendees. And then in 2021, we hosted a virtual conference. And then in 2022, we hosted a hybrid conference, all thanks to COVID, of course, but with both in-person and virtual attendees. And just from, with everything that was happening with COVID, we still had over 1,000 individuals attend in person, and then we had over 60 breakout sessions, all related to policy, workforce development, research, and culture shift tracks. Now I'll go into just some data and some background on Black maternal health inequities. According to recent data from the CDC, over 850 women die each year in the US as a result of pregnancy or delivery complications. What's more alarming are the racial and ethnic disparities that exist in pregnancy-related deaths. Increasing gaps in the pregnancy-related mortality ratio between racial groups has continued to widen over the past 15 years, with Black women experiencing the biggest burden. But it is also important to note that 80% of these staggering numbers of maternal death are preventable. So furthermore, it should also be noted that the maternal mortality rate in the US rose between 2018 and 2020, showcasing the impact of the COVID-19 pandemic on the pregnant population, and it's resulting in nationwide healthcare system disruptions to maternity care. And unfortunately, in 2020, Black women were most disproportionately affected by maternal death, with a mortality rate of 55.3 deaths per 100,000 live births. That's a significant increase from 2019 to 2020. We love to give a little historical context to maternal mortality. So I'm not sure if many of you are aware, but it is always important to share the historical events that have contributed to maternal mortality rates in the US. So when presented with health disparities in maternal mortality and the appalling statistics of Black maternal health in the US, we must always take a deeper dive into the root causes of these issues. The regulation of Black women's reproductive decisions has been a central aspect of racial oppression in America. Enslaved, pregnant Black women were forced to work in plantation fields up until their labor. They were rarely given any chance to rest or to bond with their babies. And they were also required to go back to the fields with their babies strapped on their backs. So the institution of slavery in the US opened the door for all types of unjust medical experimentation on Black women's bodies, from experimental vaginal surgeries without anesthesia to stealing cervical cancer cells, all in the name of advancing science. And so historically, we know Black midwives were vital maternity caregivers for communities, especially in the South. But over time, discriminatory public policies restricted Black midwives from practicing, resulting in the near depletion in the maternal care workforce. Black physicians and hospitals helped fill critical gaps in care during segregation, and we are grateful for the groundwork that the National Medical Association has laid for Black doctors, public health practitioners, and for advocates. So in response to the high rates of sickness, mortality among African Americans during the Reconstruction era, Black institutions such as the Tuskegee Institute, churches, community organizations, and Black Women's Club, they started health education and preventative service initiatives like the National Negro Health Week in the early 1900s. So with the momentum of the women's rights movement in the late 1970s and 80s, Black women health advocates fought for maternity-related benefits and advocated against state-sanctioned eugenics practices that targeted African American women on welfare with forced sterilization. So with these historical and ongoing violence and trauma on Black women's bodies, it's a crucial part of the contributing factors that has led to the adverse health outcomes that we are seeing today in Black maternal health. It is from the historical health organizing of Black midwives and Black women-led organization that BMMA derives its foundation in building the movement to advance Black maternal health, rights, and justice. And it continues to fight to end maternal mortality globally. So today we are faced with a serious maternal health crisis in the US, and some of those system challenges in maternal health are that partisan politics are significant hinders of comprehensive maternal health policy rooted in equity and reproductive justice from being passed. Policies that only look at services within the traditional medical context are extremely limiting and does not address the core problems of health inequities. They often, at this point, further exaggerate the problem. Currently, there's a lot of interest in health equity, but how health equity can be achieved is still not fully understood. Maternal health is still deeply entrenched in the patriarchal narrative that only cares for the woman's body in relation to being able to have a healthy baby. Interventions to address adverse maternal health outcomes focus heavily on individual behavior change. So there's not a serious investment in community-driven solutions in maternal health care. And that's led to by the communities that's getting most impacted. And while this is not an exhaustive list of challenges of addressing maternal health disparities, through all of this and including the historical traumas on our bodies and the system of oppression in our communities, Black women have always still led the charge to advocate for ourselves and create avenues of resilience and healing. So the work that BMMA conducts while engaging in collaborative initiatives and informing system change are part of our foundational documents that we've published within the last 5 years. Some of these literatures and toolkits advocates can use as a guide to support Black mamas, the perinatal, maternal, sexual, and reproductive health workforce, and reduce maternal mortality and morbidity. I can share our link where you can find some of those at the end of our presentation. So now I'll go into BMMA's journey of writing up our comprehensive policy agenda. And so for the past several years, BMMA has worked to develop and articulate frameworks and principles that inform Black maternal health policy. So as mentioned, we utilize the reproductive justice and birth justice framework to advance a human rights-based approach to respectful birth care grounded in the scholarship of Black feminist and womanist perspectives. BMA hosted the first Congressional Hill briefing back in June 2017, and that focused primarily on Black maternal health and reproductive justice. So BMMA provided statements to the United Nations Office of the High Commissioner for Human Rights at the International Decade for People of African Descent in Geneva, Switzerland. That was back in 2017. And so BMMA's policy, vision, and work was instrumental to the foundation and the launch of the Black Maternal Health Caucus, which was founded by Representatives Alma Adams and Lauren Underwood. So this large bipartisan caucus spearheaded the Black Maternal Health Omnibus Act, which is a legislative package of several bills that seek to address every dimension of the Black maternal health crisis in the US. So this package was written by and for Black women, birthing people and birth workers, and take a proactive approach to addressing many of the systemic public health challenges that we're facing every day. Well, every year, BMMA has collaborated with partners, developed and disseminated policy reports, webinars, and other materials and resources over the last few years. But back in 2019, BMMA hosted their annual convening with alliance partners to discuss Black maternal health issues and develop strategies. So this is where the policy agenda was created, was birthed. And it was to inform by alliance partner policy recommendations and insights. At the convening, our alliance partners broke up into groups and provided challenges and solutions to these issues. And from there, we pulled all those documents together. We held listening sessions to finalize the policy agenda. And so as an alliance of Black-led multidisciplinary professionals, we see the policy agenda development process as a unique opportunity to build consensus and to articulate priorities that come from those doing work on the ground. So for these reasons, we decided that the logical step in BMA's journey is to develop a comprehensive issues and value-based policy agenda to guide all of our policy and advocacy work moving forward. So also throughout this presentation and speaking about the policy agenda, you'll hear me say the phrase Black-led and centered, Black-led and Black-centered organizations. And that's defined as an umbrella term to describe entities that are intentionally led by self-identified Black people of African heritage and descent, and are in existence to support, advocate, and provide resources in their communities. So out of our, the way that when we got together with the alliance partners, we said, these are our 3 priorities in Black maternal health, policy, and advocacy. So the 3 are to identify and ensure mechanisms for engagement and prioritization of Black women and Black women-led entities in policy and program development and implementation, establish equitable systems of care to address racism, obstetric violence, neglect, and abuse, and also to expand and protect meaningful access to quality, affordable, and comprehensive healthcare coverage. That includes full spectrum of reproductive and maternal health care services for Black women. So effective maternal health policy action looks like investing in the time and expertise of Black women-led organizations, creating opportunities for evaluation and redesign of health education curricula that are led by Black-led organizations, and then also to encourage and permit insurance coverage of services provided by perinatal health workers, community health workers, doulas, and other paraprofessionals working within the community. In my presentations, I always like to acknowledge the folks who came before me and who worked on the policy agenda, which is Clark Wheeler. She was our former federal policy manager, of course, our executive director, Angela Ina, and co-founder of BMA, former state policy manager, Renee Nicholson, and co-founder of BMA, Elizabeth Gay. So all of these individuals attended our alliance convening and of course our alliance partners. I won't be able to go through the whole policy agenda for this webinar, but I wanted to share that our agenda is organized in 6 overarching policy issues that are essential to the work that BMA and our partners do across the US, and it represents the issues of which BMA is frequently engaged and endorse legislation. So the 6 overarching issues are the structural and social determinants of Black maternal health, full spectrum maternal, sexual, and reproductive health care, Black maternal, reproductive, and perinatal workforce development, criminalization of Black women, birthing people, and their families, research and data transformation, Black women and birthing people's leadership. Black women and birthing people's leadership. So BMA sees the policy recommendations outlined in this document as strategies that can only be advanced and implemented through the Black feminist leadership at the center and through collaboration across sectors, disciplines, and geographies. So it's important to note that while these policy issues are siloed for the purpose of this document, they are not siloed in Black women and Black birthing people's lives. So again, I won't be able to go through the whole agenda, but we're going to stick to the structural and social determinants of health, of Black maternal health. So every day, Black women and birthing people interact with a series of structures and systems that impact Black maternal health outcomes. Studies have shown strong associations between factors such as housing security, environmental toxin exposure, or workplace mistreatment, and maternal health outcomes such as preterm birth, low birth weight, and a range of pregnancy complications. And these relationships are explained through social determinants of health, the framework. So through traditional public health and health policy focus on individual health behaviors and interventions, the social determinants of health framework shifts the focus from individuals to other systems and structures that largely determine health outcomes. This framework is useful, but incomplete without an analysis of structural and institutional racism in policy and practice. Historically, policymakers have used controlling images of Black womanhood to dent Black women and birthing people, everything from cash assistance to clean air and water, all while blaming them for their maternal health outcomes. And for that, this is why we came up with the policy recommendations that reflect Black women and birthing people's needs across the structural and social determinants of Black maternal health. And those are to identify, eradicate, and provide restitution for systemic and structural harms against Black women and birthing people in the following social determinants of health, which again includes housing, safety net, wraparound services, environmental justice, pregnancy accommodations and labor rights, human milk feeding, infant formula, and food sovereignty. Also includes health education, empowerment, community and social wellness, and human rights. The second is to provide sustainable grants and investments to Black-led and Black-centered community-based organizations that work to address the social determinants of health and to advance health equity for Black women and birthing people. And lastly, to center Black women and birthing people in the development and implementation of equitable and culturally relevant systems and structures, both domestically and globally. So as discussed in the previous slide, Black women and birthing people interact with a series of structures and systems that impact their Black maternal health outcomes, including workplace mistreatment. Just to give a little data, nearly 30% of pregnancy discrimination complaints are filed by Black women. This is because of the multiple forms of discrimination Black workers and other workers of color too often face in the workplace. These participation rates are not only high, but also compounded by the fact that Black mothers are already at higher risk for pregnancy-related complications such as preeclampsia, preterm birth, and even fatal complications. For these reasons, Black mothers are especially in need of better pregnancy accommodations in the workplace. So our specific policy recommendations that we have for pregnancy accommodation is to first, to give some data points on pregnancy accommodations first, is that first 3/4 of women will be pregnant and employed at some point in their lives. Most pregnant workers can expect a routine and a healthy pregnancy. However, 1 in 5 pregnant workers occupy physical demanding jobs that require prolonged standing, continuous and strenuous movements, long hours, inconsistent work schedules, and or heavy lifting. So these physical demands can cause issues during pregnancy, such as preterm birth, low birth weight, and miscarriages. Moreover, many full-time workers in low-wage jobs are not allowed flexibility with respect to when they take their breaks, their start and quit times, and their schedule in general. And then just to skip over, because I know we're going over time. And lastly, Black birthing people are also at a higher risk of preeclampsia, which is one of the leading causes of maternal mortality. So to go back, our key policy recommendations for pregnancy accommodation and labor rights, because many pregnant and postpartum workers still face rampant pregnancy discrimination, including being denied adequate accommodations in the workplace, we said that we want to establish a nationwide legal right for millions of workers to earn paid sick time to use when they or their family members are ill or need medical care, enact policies that support union organizing and center Black women, birthing people, our families, and communities in the resurgent labor movement. This is needed as Black pregnant and postpartum people are forced to keep working to the detriment of their health. And then lastly, strengthen pregnancy accommodations and workplace protections for domestic workers, entrepreneurs, and other workers who have unique labor environments. From the listening session, we encountered anecdotes in which pregnant workers either lost their job as a punishment for asking for accommodations or just quit entirely because they were not being accommodated. So this reflects a hostile work atmosphere around pregnancy that left some workers too afraid to even approach their employers about accommodations. You'll hear more about this later, but some of the work that BMA has done, of course, is worked with a better balance on the joint report. We conducted listening sessions with Black birth workers and organizational leaders in our alliance. And then just to give an idea, it's folks from California, New York, Georgia, all around the states. And then we've also engaged with the U.S. Department of Labor to get the PUMP Act passed in Congress. The PUMP Act extends coverage to over 9 million employees, including teachers, transportation workers, and agricultural workers. So BMA will continue to work with external entities like a better balance and the Department of Labor to ensure that the implementation of these bills are at the state and local level. Really quick advocacy strategies that we have is contact your state and local representative. Let them know that this is what we need. This is what we need them to support and get behind. You know, on the individual level, advocacy efforts to improve pregnancy accommodations. Again, contacting your state and local representative, uplifting and disseminating the stories of pregnant workers, and also supporting community-based organizations. You can find all of our work on blackmamasmatter.org. This is when we had our virtual rally back for Black Maternal Health Week, and we had lots of representatives from Representative Alma Adams, Gwen Moore, Park Cannon, Lauren Underwood. They came and spoke on different parts of the policy agenda. And then any resources that anyone may need, whether it's the reports, the issue briefs, or some articles, that can be found on our website. And then lastly, we have our Black Maternal Health Conference coming up in Atlanta, Georgia in 2024. Registration hasn't opened up yet, but we will have a call for abstract coming out next month. And then once registration is open, you'll be able to see that on our social media and if you're signed up for our newsletters. And that's it. Be sure to stay connected, and I'll pass it over to Cameron.
Thank you so much, Stephanie. I really appreciate that thorough rundown of the historical significance and just the history of how the labor workforce has in this country has exploited Black women and Black birthing people for centuries, but how we can really strategize and work together, whether it be the kindred partners or outside partners, to join and share those experiences and make that institutional change. So definitely as folks are learning more about BMMA's work or ABB's work, feel free to reach out to us. We will share our contact information at the end and, are really looking forward to continuing to collaborate on some of those other policies you highlighted. We still need paid sick time. We still need paid family and medical leave on the state and the federal level. And many of our partners are working on all levels, including local levels, to make sure that Black mothers, Black birthing people, and workers, caregivers have the rights that they need. So with that, I'll turn back to what A Better Balance is all about. And on the next slide, you'll see that we are a national organization that advances justice for workers so they don't have to choose between caring for themselves and their loved ones and risking their job, because it's not a choice that anyone should have to make. We often find that Black people are often less likely to have flexible scheduling or access to paid medical leave, and often are not choosing to care for themselves. They are continuing to work, which can aggravate existing medical conditions. And so we have offices in New York City, Nashville, Tennessee, Denver, Colorado, New Orleans, Louisiana, and Washington, D.C. But I work primarily in our Southern office in Nashville, Tennessee, and we work on advancing legislation such as paid leave, paid sick time, and pregnancy accommodations, as well as caregiver discrimination, and having expansive family definitions in those laws, as many of us are caring for multiple family members, including grandparents, or, are also caring for those that we love in our chosen family. And it's important to include those. Next slide, please. So just a little bit of history of how we came to win the Pregnant Workers Fairness Act. It was a long, hard fight, as many of you already know. On December 22nd of last year, the PWFA and the Pump Act passed the Senate as part of an omnibus spending package with the vote of 73 to 24 and 92 to 5 votes respectively. And they passed the House the very next day, and President Biden signed them into law on December 29th. And the passage of these laws, I can't understate it, is really the culmination of a decade-long campaign where pregnant workers and working moms, along with community-based organizations and national organizations, really came together to share their experiences and demand change and protections, as no longer could pregnant workers go without the care that they needed and the protections. And so as A Better Balance, we really are proud to have launched this movement in 2012. And we have been leading this movement for 10 years, working strategically with groups from across the spectrum: civil rights groups, unions, business groups, maternal health organizations, and faith leaders nationwide, going state by state to make the case and help garner strong bipartisan support. And a lot of this journey started in 2012 when our co-founder Dina Bax published a New York Times op-ed called Pregnant and Pushed Out of a Job. And the very same day, Representative Nadler promised to introduce legislation to fix the problem, which led to the PWFA's ultimate introduction in Congress. And in that op-ed, our co-founder highlighted how many pregnant workers who were still working far into their pregnancies were pushed out of the job if they asked for a reasonable accommodation, such as light duty or a lifting restriction or access to a water bottle. And so, what that really highlighted was the start of a movement, not just a moment, that the need for legislative change was apparent. And so, from 2013 to 2021, it led with New York passing a local PWFA on the city level, and this sparked a concerted state and local movement that led to ultimately 30 states and 5 cities passing legislation that protects pregnant and postpartum workers. Next slide. And so how do we start this movement? We first had to begin with the legal case. And oftentimes when talking with legislators, we were answering the question of, is this really a problem? Are people really being discriminated against for their pregnancies in 2021 or in 2019 or 1999? And ultimately, we did find that um, even now there were gaps in the law. There were gaps that existed in federal law that made it impossible for women in low wage and physically demanding jobs, which were disproportionately women of color, to get the immediate relief that they needed to remain healthy and on the job. And we knew differently that the current federal laws were not sufficient. And our report in 2019 called Long Overdue highlighted how 2/3 of pregnant workers were actually losing their cases for accommodations under the Pregnancy Discrimination Act because of gaps in the law. They may not have been able to find a comparator or another employee who was needing the same accommodations, or they may not have been able to find an existing policy. And so what really was needed was legislative change, as many pregnant workers like Tasha Morell, who was here in Tennessee, were actually pushed out of the job. And not only that, they experienced a fateful miscarriage because of the lack of accommodations in the workplace. And so in October 2019, with all of these things moving in support, with the support of our organizations like Black Mamas Matter Alliance and Moms Rising and the USBC, United States Breastfeeding Coalition, we really did, have our first hearing on the congressional level that was also called Long Overdue. And we got to let Congress members hear about the experiences of pregnant workers and how the need for an explicit right to pregnancy accommodations was needed. Next slide. Another strategy that we used was uplifting community voices. So not just hearing from our helpline, our free and confidential helpline, and helping workers understand their rights, but also finding ways to uplift community voices. And we did that through the Centering the Experiences of Black Mamas in the Workplace report that Stephanie mentioned in March. And we also created sign-on letters to urge Leader Schumer to pass the Pregnant Workers Fairness Act, and highlighted the issue in articles such as Essence. And so, what was really important was continuing to center the voices of those that were most affected and to give them the opportunity to talk with stakeholders and really share why this was important to them and their families. And so, we really were able to have a concerted effort through these different activities throughout the years to really make sure that momentum did not die down and we were able to pass the Pregnant Workers Fairness Act in December. And so I want to share a little bit more about the report. We did have a listening session earlier on with 9 states that included Alabama, Georgia, Florida, Texas, Ohio, Michigan, Maryland, California, and New York. And, we met with Black birth workers and organizational leaders from those states to really discuss the issues that their Black mothers or Black birthing people that they served were really experiencing as they navigated their pregnancy in the workplace. And we also talked about issues like lactation accommodations and paid family leave and paid sick time. But what we found was that there was a constant thread of workers being denied accommodations, workers being ignored for their health needs when they did try to address it with their manager or HR. And the constant need for really having stakeholders like legislators listen to pregnant workers, because of the history of reproductive oppression and labor exploitation in the United States. And so we can't just ignore the fact that a lot of these systemic institutions have for years disproportionately discriminated against Black workers, but we have to figure out policies that can address that and also positively impact the maternal health of Black workers. So these dynamics really call for the need for a holistic approach, not just a siloed solution. And the Pregnant Workers Fairness Act is just one tool in the toolkit, but there is a need for collaboration between researchers, policymakers, and organizations so that we can bring those experiences to the forefront and call for, holistic solutions. And on the next slide, you'll see just a few of the takeaways that we heard from the listening session. So we heard from a birth worker in Alabama, Danica Davis, who ran a breastfeeding support group in Birmingham. And she had one mother who was a front desk clerk at the Children's Hospital, and she was in need for an accommodation. She was proud of having established breastfeeding with her daughter, and she went back to work just after 6 weeks. So she was not fully healed, but she had to go back to work after 6 weeks. Now, when she called for, break time to continue pumping at work, she ended up quitting because she couldn't get this accommodation honored consistently by her manager. And at this time, the Pump Act was not in place, and she may have been excluded under the law because she was a clerk worker. But, she went to HR to try to advocate for herself and her needs, and they pretty much kicked it back to the manager's discretion, which had previously denied her. And so, as we see, the constant negative health outcomes that Black birthing people are facing because of the lack of access to those flexible schedules, we really did, hear how the social determinants of health can impact not just the physical health of workers, but also the mental health. The stress, Cherise Scott from Sister Reach in Tennessee also noted that the stress of losing a job or not having a good relationship with your employer due to your pregnancy is itself a social determinant of health. Poor, low wage birthing people are doing what they have to do to take care of themselves and their families, and that means that taking abuse is often the end result. Pregnancy accommodations are essential to employees and employers. Culture shift doesn't change overnight. Workplace culture doesn't change, but having these tools available can help employers learn how to develop more equitable workforces. And it's really sad to see this in 2021, when this listening session happened, birthing people are often an afterthought, and that can have a negative impact on their health and the health of their communities overall. And so this report was really critical in highlighting to Congress members, how the Pregnant Workers Fairness Act can positively impact Black birthing people's health and economic security. As Stephanie pointed out earlier, the lack of access to pregnancy accommodations can often lead to preterm birth, miscarriage, and other negative health outcomes. But as Reverend Deneen Robinson, who is formerly a member of the AFIA Center in Texas, noted, the Pregnant Workers Fairness Act will positively impact Black birthing people's health and economic security. By putting this federal standard in place, the Pregnant Workers Fairness Act has the potential to be a viable avenue to improve the experiences of Black pregnant people in the workplace. And furthermore, it can remove one of the many barriers that Black pregnant people face at work by ensuring that they are afforded that immediate relief under the law and not thrown into financial dire restraints for needing pregnancy accommodations. And oftentimes, Black pregnant folks get caught in between the space. They're either not sick enough to be accommodated, but it's not a real thing. My sickness is not visible. Since it's not visible, it's not real. And so, what legislation like the PWFA does is it calls to name what Black pregnant people are facing, and gives them an avenue to really advocate for their health and their well-being while also providing that right to, receive those accommodations and also be protected if their rights are being violated. So real quickly, I just want to highlight that, we could not have done this work without our legislative champions. And if you see on the next slide, Representative Nadler, who was the main sponsor in the House, really highlighted what the importance of this was to his colleagues, and armed them with we were able to arm them with talking points and information as well as worker stories to get this over the finish line. And we were able to maintain such a deep relationship with Nadler throughout the entire campaign because he understood the importance of this for working families. And another representative that I do want to highlight is Lauren Underwood, who has been a major champion and one of the most powerful messengers that the PWFA was a key part in addressing the Black maternal health crisis. And we are really honored to have her support as she was able to vouch for the Pregnant Workers Fairness Act as well as the Momnibus Act. And in addition to that, we were able to develop relationships with legislators across the aisle as well. So that way we could have bipartisan support. And the momentum from the state work really led to having those strong relationships with legislators. And I'll be able to share a link to our report, which highlights many of these other strategies after our webinar as well. Next slide. So, what does this win mean to workers? We were able to have our community advocate, Natasha Jackson, say at the rally last December that she was forced out onto unpaid leave after requesting light duty. So, in order to avoid pregnancy complications. And she went from financially thriving to homeless in just a few months. But with the news of the law passing, she cried, profusely. She just continued to cry. And she just thought, I have two daughters, I have a niece. I'm so grateful that now, they don't have to choose between starting a family or keeping their jobs. And there are millions of other women like her who, now have that protection on a federal level that covers all 50 states. So it doesn't matter your zip code or how much money you make or what type of job you do have that right to an explicit accommodation. And we were able to celebrate this win at the White House, where many of our community advocates were actually congratulated by President Biden. And so I just want to share a quick mention of that on this slide with Natasha Jackson hugging the president. And we could not have done this work without, the administration's support. Oh, sorry, can you show that on the next slide? There she is. And, we continue to work with agencies, as Stephanie highlighted, like the EEOC, the Equal Employment Opportunity Commission, as they are overseeing this law. But right now, it's not enough to just pass these laws. We need to make sure that workers are able to use them and they know about their rights. And so that's why it's important to work with community-based organizations, service providers, as well as maternal health advocates and others to make sure that, those who need these laws know how to use them and they are continuing to be supported. And so we truly believe that we can replicate this successful campaign on the state and the federal level with campaigns like paid family and medical leave and paid sick time. So that's why it was important for us to share a few of these strategies just today. And so I know we're a little bit short on time, but I did want to give an overview of the PWFA. So it went into effect on June 27th. And, if you are pregnant or have pregnancy related needs, you can request an accommodation for known limitations related to your pregnancy, childbirth, or related medical conditions. And this law covers all employers that have 15 or more employees. It also covers federal employees, and there is an exception to providing accommodations, but an employer must show that they have that providing that accommodation would be an undue hardship. And that usually means it is too expensive or too difficult for them to do based on the facilities that they have and the resources that they have. But it is a defense that an employer must prove to the employee. So that way, they don't violate the law, but many times these accommodations are free or have relatively no cost. So, next slide. So here's just a quick list of the types of accommodations a worker can request. The law does not have an explicit listing in the language, but here are just a few examples. So such as frequent or longer breaks, bathroom or rest breaks if they need to have a drink or food modification to the policy, and then also if they need to have temporary inside duty to avoid hot or excessive heat, as well as cold weather. So, some other accommodations we've heard from in the past are also if they need to be temporarily transferred to a less strenuous or hazardous position, they can have a coworker assist them in that. Modifying a work schedule or assistance with heavy lifting. And then I will say too that this law does cover workers with lactation accommodations. And so if they need access to a private space or break time to pump, they can also do request time off with the Pregnant Workers Fairness Act. And this law does cover some workers who are previously excluded under the Pump Act, such as workers who are airline flight crew or flight attendants, and also those who may not yet be covered under the Pump Act, such as those who work for train crew. But if they also need a modified equipment because they are nursing, they can also request that under this law. And research has shown that many workers are not eligible yet for the FMLA because they may be either part time or have not worked at their job for a year, or they may work for a small employer that has less than 50 employees. So the PWFA does also provide time off to recover from childbirth, even if you are not yet qualified for the FMLA. Now, the length of that time is subject to the proposed regulations that the EEOC is putting out, but it could be 6 weeks to 8 weeks, or even 12 weeks. But you do want to ask your employer for that time off and see what can be a reasonable accommodation. And it also includes accommodations for postpartum medical conditions uh, miscarriage or mastitis, as well as postpartum depression and anxiety. This law does cover mental conditions as well as physical conditions, as long as they are related to your pregnancy or childbirth. And, it does also apply to those who are trying to become pregnant. So we do have some resources on our website at abetterbalance.org/pregnant that do highlight a sample explainer letter for your employer, as well as a sample request letter if you are serving folks who are needing accommodations in the workplace. That letter has language around what the Pregnant Workers Fairness Act provides. And so the first step in the interactive process is to let your employer know that you do need an accommodation related to your pregnancy. You don't have to use magic words or even submit this in writing. You can ask over the phone or in person, but it is good oftentimes to share with HR or your manager what your pregnancy needs are and how you can work with them to try to figure out a reasonable accommodation. And we've often heard back from workers from our helpline that they've had success using some of those sample letters and explainers, because oftentimes they may be educating their employer on this new law or helping other workers advocate for their health and are sharing those resources. So we do have those free on our website for those who are interested in helping birthing people or pregnant people advocate for their health and request those accommodations. And just to recap, even if you're not able to perform some of your main job duties, this is sometimes referred to as an essential function. If you are able to do those duties in the near future, because pregnancy is a temporary time, then you can still receive those accommodations. Your employer cannot just say no to your request because you're not able to perform some job duties. Your employer also cannot retaliate against you or punish you for needing or using an accommodation. And so, if they are taking adverse actions against you, like cutting your hours or demoting you, that can be a violation of the law. And we're happy to help workers navigate those rights on our free and confidential helpline, which the number is posted below. And just here are some final recaps of employee protections. So not just, forcing an employee to take unpaid leave if an employer is not looking at what reasonable accommodations can be done. That can itself be a violation if the employer does not go through that interactive process. And so we really just tell folks to try to work with their employer to see, is there an alternative accommodation that can be made. And there's also, protections against forcing an employee to accept an accommodation they don't want to take. And then I'll just say too, any retaliation for reporting a legal violation is another violation of the law. And so workers have 180 days to, after the alleged discriminatory act, to file a charge with the Equal Employment Opportunity Commission, or the EEOC. And right now, we are working with the EEOC to make sure that they keep the proposed rule as strong as possible, that explains the laws, things that weren't in the language. And you'll see on the next slide that, you know, the EEOC is charged with having released a final rule by the end of December. Today is actually the final day to release comments to the EEOC for the proposed rule that they have. But while the EEOC is figuring out those rules and regulations, 30 states and those four localities, including DC, still have a law on the books. And so those laws are not preempted. They are still active. So it gives an additional protection for workers who may be in those 30 states. And these generally do mirror the federal laws, but they may have different changes with the amount of employees they protect, or the amount of remedies that they provide. So just wanted to flag that we are still working to make sure that workers know about these laws, and that state agencies and courts enforce these rights. But definitely feel free to reach out to A Better Balance or view our resources on our website if you have any questions about the law. And so I know we're at time, but I just wanted to go over some quick mentions of the Pump Act, and we'll definitely release this recording as well. And answer any questions you may have. Feel free to send those to Rachel, or me, or Stephanie. We'll send our contact information just in case we don't have time to get to that today. But back in 2010, the Break Time for Nursing Mothers law passed, and this was a momentous law for many postpartum workers who were needing nursing breaks and reasonable space to pump. And so, but what we found was, like Stephanie mentioned, about 9 million or so workers were not covered under that law because they were previously excluded under the Fair Labor Standards Act. And so our partners at Moms Rising, the ACLU, the Center for Work-Life Law, National WIC Association, and United States Breastfeeding Coalition, along with former Representative Carolyn Maloney, who's been a longtime champion of the Pump Act, really worked to expand those rights, worked alongside A Better Balance to expand those rights to receive, for those 9 million workers to receive reasonable break time and a clean private space. And this law went into effect upon signing on December 29th. And it extends protections for up to 1 year. So if you continue to need break time and space past that year, you may be able to use the Pregnant Workers Fairness Act to advocate for that additional time, since the Pump Act is limited to 1 year. And there are some specific exceptions with this law that I do want to mention. For certain employees that are rail carriers or motor coaches, this law is going to go into effect in 2025. And this law does not apply to flight attendants and pilots. But again, there may be additional protections under the Pregnant Workers Fairness Act. And another proponent of this law went into effect on April 28th, 2023, and that is the right to file lawsuits for violations. Previously, under the federal Break Time for Nursing Mothers law, you could just file a claim with the agency. But I'm just going to explain a little bit more about the right to file a lawsuit. If you click one more time, it'll go through. So with the law, it does not require that the break time be paid unless it happens ordinarily through a regular paid break. So if you are given, two 10-minute breaks and you use those break times for nursing, then you must be paid ordinarily as you would on your schedule. But if it goes beyond those 10-minute paid breaks, then that additional break time may not be paid. But if you're also doing work while you're pumping, if you're a teacher and you're grading papers during your break, then that should be counted as compensatory break time. And again, we're able to help workers kind of navigate their rights to break time and space at our free and confidential helpline, which is posted down below. So, if there has been a legal violation or the worker believes that their rights may have been violated when they request additional breaks to pump, which can be as needed, there's not a limit to how many breaks you can request. Before the lawsuit, the worker has to notify their employer if the space is not adequate. And this space needs to, be clean and free from intrusion, but it cannot be a bathroom. So, if there is if any of those options are being violated, if they're being forced to pump in a bathroom, they need to let their employer know and give them 10 days to correct that. Now, they are not required to give employers an opportunity to correct if this is a time violation. So this is only for if a worker needs space. And also, you are not required to file a complaint first with the Department of Labor if after those 10 days your employer um, doesn't correct the issue, or if you have a time violation, you don't need to go first to the agency. You can file immediately and then file a lawsuit in court. So there are several states that have a state law that provides protections for lactating workers expressing milk in the workplace, and these work, in tandem with the Pump Act. They're not preempted as well, but several of them do mirror the same language in requiring unpaid break time and space. But as we are continuing to advocate for workers and caregivers in the workplace, we are continuing to push for things like paid break time or filling in gaps in the federal and state laws. And so we definitely encourage you to contact any of those organizations I may have missed if you're interested in sharing your experience or joining in those efforts. The DOL does not have any rulemaking at this moment, but they do have a lot of resources on those laws. And I will just say the pregnant and postpartum workers hub page that we have does have a summary of all these laws, as we've covered a lot today. So feel free to take a visit there or to also visit our sample letters and explainers. And with that, I think we can see if there are any questions in the Q&A, but I really again just want to say thank you to everyone for staying on a few minutes past and really, you know, visiting and learning more about these laws. And feel free to put any questions in the Q&A, or you can also email Stephanie or I. Will put our email in the chat, but we'll send those follow-up resources we mentioned um, in the next coming days along with the recording. All right, and I'm seeing no questions yet in the Q&A, but want to thank everyone for joining, and I hope you all have a great day, and feel free to use our resources to educate workers or to join in our advocacy work in the next coming year as we continue to advocate for working families in this country and Black mothers in this workplace.